Hello, today's class we will be discussing about one important class of antibiotics, that is penicillin, which will belong to beta-lactam group of antibiotics. So to begin with, what is beta-lactam antibiotics uh, in short? So basically beta-lactam group of antibiotics, they are the antibiotics which have something called as beta-lactam in their structure. Okay, so it is a box shaped structure. So whichever group of antibiotics which is having this beta lactam ring, they are called as beta lactam antibiotics, and they are most commonly used antibiotic worldwide. Okay, and in beta lactam group of antibiotics we have penicillins, we have cephalosporins, okay, and carbapenems, okay, and monobactams. These four class of antibiotics will all belong to beta lactams, and one among them is penicillins, which are very commonly used antibiotics, and we will be studying about these things today. To begin with, what is its mechanism? So basically, these group of antibiotics, they act by inhibiting cell wall. Okay, in the general consideration of antibiotics, we have seen that there are cell wall synthesis inhibitors, protein synthesis inhibitor, various type of antibiotics. So this group mainly are involved in inhibiting the cell wall synthesis. How do they inhibit is they act by inhibiting an enzyme called as transpeptidase. Okay, to understand what is transpeptidase, what is this cross linking which is done by transpeptidase, we will just look into this picture. Basically, the bacterial cell wall is made up of two uh, amino acid, that is N-acetyl muramic acid and N-acetyl glycine. Okay, see, like this a straight uh, chain is formed by N-acetyl muramic acid and N-acetyl glycine. Okay, once this chain is done, like this long chain, these two amino acids or this chain is cross linked by an enzyme called as transpeptidase, and there are certain enzymes and proteins which are involved in this process, which are called as penicillin binding proteins. Okay, and they will do cross bridging or cross linking like this. Okay, this is what is inhibited by our penicillin group of antibiotics, and that is why they will produce resulting in a deficient cell wall. Okay, and what happens then, the water enters into the bacterial cell, causing hyperosmosis, and the cell will swell and burst, resulting in bacterial cell lysis. Okay, so they mainly involve or they inhibit the cross bridging which is done by transpeptidase enzyme, and the cell wall will become deficient like this wherever this enzyme goes and act. So, and then what happens, the water enters into the cell will become deficient and it will burst open. So this is the mechanism of penicillin group of antibiotics, and even cephalosporins, which are beta lactams, also act by this mechanism. Moving on to the difference between gram positive and gram negative organisms. In gram positive organisms, there will be a thick layer of peptidoglycan which is seen in the cell wall. Okay, and this peptidoglycan layer will be more than 50. Okay, and that is why it is easy to inhibit and the effect is good. It is a single chain mucopeptide molecule in gram positive, whereas in gram negative what happens is, this the cell wall consists of an alternating layer of lipoprotein and a peptidoglycan layer. Okay, there is it is not only a peptidoglycan, but alternatively there is a lipoprotein layer which is not acted upon by our penicillin group of antibiotics. So it is mainly active against gram positive and not against gram negative. So moving on to the individual penicillins. Penicillin G is the natural penicillin, and we also have different other penicillins which we will be seeing in the classification later, but penicillin G is the natural penicillin. Okay, which was first discovered by Alexander Fleming. That is also very important. And why this is its features are, it is having a narrow spectrum, meaning it is only active against one class, that is either gram negative or gram positive. That is what we mean by narrow spectrum, right? So it is only gram positive active, it is active, and the activity of this is inhibited by an enzyme called as penicillinase. What is penicillinase? What does it do? It will open up or break this beta lactam ring, which I had already mentioned. So it will open up the beta lactam ring. Once the beta lactam ring is opened up, the antibiotic activity is nowhere present now. Okay, so this penicillin G will lose its antibacterial activity. Thereby also it will inactivate few proteins, target proteins, or it will change these target proteins, okay, resulting in something called as important term, that is resistance. Resistance in penicillin G is mainly because it will produce penicillinase enzyme, which will inactivate or open up the beta lactam ring, resulting in loss of its bacterial activity. Apart from this, moving on to its pharmacokinetics, it is also acid labile, meaning it cannot be given through by mouth, because in the presence of gastric juice it is destroyed. Less than 1/3 of the oral dose is absorbed. Okay, peak plasma concentration will be acquired in 30 minutes, and it is 60% plasma protein bound. Okay, these are its salient features, and this is metabolized. It is little metabolized and rapidly excreted, and its T half is 30 minutes. So it is penicillin G. Moving on to its uses, important use is it is active against streptococcal infections. So in microbiology you will be studying about what is streptococcal and where all it can infect in microbiology. So it can mainly affect the upper respiratory tract and also some extent lower. So it can cause pharyngitis, otitis media, and scarlet fever, rheumatoid arthritis. All these are produced by or disease which is caused by streptococcal infection, and this is penicillins are effective against this streptococcal infection. Also, in case of subacute bacterial endocarditis, SABE, okay, it is a condition where non-virulent organisms like Streptococcus viridans and faecalis, which is normally present in the body, will become virulent. Okay, so in this condition also we use penicillin G along with gentamicin. So it is a drug of choice. Important, this is subacute bacterial endocarditis. So next use is in pneumococcal infections. We have better drugs now. It was used previously for some organisms which are sensitive. And also in case of gonorrhea, ophthalmia neonatorum. Gonorrhea is an infection which is caused in the genitalia mainly. If a pregnant woman is having some gonorrheal infection, through delivery, if the baby also gets gonorrhea infection, it can also affect, apart from genitalia, it can cause eye infection also. In the neonate, it is called as ophthalmia neonatorum. Okay, so this condition also penicillin is one of the important class of drug which is used. Also, in case of meningitis, which is caused one of the important pneumococcal species, that is meningococci. So this condition also, penicillin is a group of drug. So moving on to its uses, it is a drug of choice in case of syphilis, which is caused by Treponema pallidum, which is the organism which is causing syphilis. Primary, tertiary, secondary, tertiary, all type of syphilis, penicillin is the drug of choice. So leptospirosis also it is used, and then in case of diphtheria, it is used to prevent carrier state. So to prevent carrier state, penicillins are used, and tetanus and gangrene also as an adjuvant. it is used, and also it is drug of choice in few other conditions like anthrax, actinomycosis, rat fever, okay, and some infections like caused by Listeria monocytogenes and multocida. And also in case of trench foot, trench mouth and acute necrotizing ulcerative gingivitis, which is one of the important conditions, severe conditions which will affect in the dentistry. So acute necrotizing ulcerative gingivitis also, which is caused by mixed infections of and few mixed infections which is occurring because of spirochetes and fusobacterium also. Penicillin G is used. Apart from penicillin G, penicillin V and amoxicillin, which we will be reading in the further slides, will also be used. And this is combined with metronidazole to prevent anaerobic infections. What we saw all this time is its uses for like for specific diseases. Penicillin is also used as a prophylactic therapy in few conditions. Very important one is rheumatoid fever. You can come across many patients of such disease. Whenever there is a rheumatoid fever, the patient will present with 2 year back history of pharyngitis like that. So this can lead to rheumatoid fever or rheumatic nephropathy, okay, rheumatoid nephropathy, and also arthritis, okay. So these are the three things. So the rheumatoid fever should be treated, and the recurrent infection and complication can also be prevented by giving prophylactic therapy, which will prevent the colonization of streptococcal infection. So how much we give is also very important. 1.2 million units every four weekly. Okay, so very important till the person will attend, because this is usually occurring in younger age group, 18 years or after up to 5 years of initial attack, to prevent recurrence of the same complication. So also in bacterial endocarditis, which can occur during dental extraction or some endoscopic procedure, catheterization, and also in some valvular defects in case of endocarditis, these conditions also penicillin is one of the choice of drug. And also in agranulocytosis patients, it can be used alone or in combination with streptomycin or cephalosporin. It is also one of the choice of drug. So moving on to its adverse effects, very important. When given through local injections, so it can cause local irritation and direct skin toxicity. Apart from this, hypersensitivity is an important common side effect of penicillin group of drugs, and 20% of patients who are allergic to penicillin have also shown allergy to the cephalosporins. So hypersensitivity with penicillin, very important. Always you have to take a history, and always the patients with penicillin who are allergic, they will be given with a card which they will be showing at every place, so that this group of drugs will be avoided in such patients. So penicillin allergy is also one of the side effects. One rare side effects with penicillin is Jerich's-Herxheimer reaction, which is seen in patients when penicillin is given in patients with syphilis. What happens here is there will be shivering fever, myalgia, and exacerbation of lesions, okay, and also valvular collapse. That is, the symptoms will get aggravated, and this is mainly due to some dead syphilitic products which are suddenly released and the symptoms will last for 12 to 72 hours, and these are the important side effects of penicillin. So moving on to the classification, we saw penicillin G, okay, which is the prototype drug, and it is naturally obtained, okay. And alternatively, we have acids resistant. So in penicillin G, we saw it was acid labile, right? It will be destroyed by acid, but this is acid stable. This is penicillin V, or it is also called as phenoxymethyl penicillin. Okay, and those drugs which, or those antibiotics which are penicillinase resistant, we also saw it as penicillinase sensitive and it is destroyed. So methicillin, cloxacillin and dicloxacillin, they are penicillinase resistant. Extended spectrum. Why extended spectrum? Because our penicillin G was a narrow spectrum antibiotics. So we have aminopenicillins, okay, carboxypenicillins and uridopenicillins. Okay, individually we will study in detail. And some drugs which are active against the beta lactamase, which are also called as beta lactamase inhibitor. That is, the beta lactamase is a enzyme which will open up the beta lactam ring, right? So beta lactamase inhibitor means because some bacteria will also produce beta lactamase enzyme, so that this penicillin will become inactive. So this clavulanic acid, sulbactam and tazobactam, which are beta lactamase inhibitor, so though if those organisms produce that enzyme, it will be inhibited by these group of antibiotics. So moving on to the individual class. So penicillin V, we saw it will differ from penicillin G by being acid stable, and this is orally absorbed because it is acid stable. And antibacterial spectrum, it is similar to penicillin G, and it is used in streptococcal, pharyngitis, sinusitis, otitis media, and also in case of prophylaxis of rheumatoid fever. And this is also in case of less serious pneumococcal infections and French mouth like penicillin G. So since it is an orally given penicillin, so 250 to 500 milligram 6th hourly can be administered. So moving on to penicillinase resistant penicillins, we have methicillin group of drugs. So it is a prototype, that is methicillin is a prototype drug. Apart from methicillin, we also have oxacillin, nafcillin and cloxacillin, okay, and dicloxacillin. These are the drugs. And methicillin is highly resistant to penicillinase, okay, but not acid resistant, okay. It should be injected. It is an injectable drug because it is not acid resistant, okay. All these are important points. And nowadays many organisms have become MRSA, that is methicillinase producing methicillin resistant Streptococcus aureus. Streptococcus, that is one of the important use of penicillins, but many Streptococcus have been started producing methicillin. So and once they are MRSA, they will become insensitive to all penicillin resistant penicillins, okay. And also to other beta lactams as well as erythromycin. These are other class of antibiotics. For them also they will become resistant. So in MRSA group of organisms, there will be altered penicillin binding protein which do not bind to penicillins. This is what is the drawback there. And for them, the drug of choice is vancomycin or linezolid, okay, important, vancomycin or linezolid. Alternatively, ciprofloxacin can be used, but important thing is vancomycin or linezolid. So moving on to the extended spectrum of penicillins, we have aminopenicillins, carboxy and uridopenicillins. Among aminopenicillins, we have amoxicillin, ampicillin and beccampicillin. Okay, so ampicillin is active against all organisms which are active or sensitive to penicillin G. In addition, they have little gram-negative specificity, or they are also active against gram-negative bacilli like H. influenza, E. coli, Proteus, Salmonella, Shigella and Helicobacterium pyrrole. All these are also effective against aminopenicillins, okay. That is why we have, it is named as extended spectrum. Not only for gram positive, they are also extended for gram-negative organisms also. So ampicillin, it is not degraded by the gastric juice. It can be used orally. There is absorption is affected by food, and T half is 1 hour. It is primarily excreted in the kidney and partly by the bile, which is then reabsorbed through the enterohepatic circulation. And they are used in case of urinary tract infection, respiratory tract infection, meningitis, gonorrhea, and also in case of subacute bacterial endocarditis also ampicillin is used. One of the important side effect of ampicillin, and that is why this is not commonly used, is diarrhea. Very, very important. Ampicillin can cause diarrhea, most common side effect. Apart from hypersensitivity, which can start from rash to anything. So commonly used side effect, and the reason why ampicillin is not very famous as amoxicillin is diarrhea. One of the other class of aminopenicillins, that is amoxicillin, similar to ampicillin, except that it is its oral absorption is better than ampicillin. It does not interfere with food. Okay, higher and more sustainable blood levels are produced by amoxicillin when compared to ampicillin. And the important side effect I told was diarrhea, which is lower in case of amoxicillin, and also it is less active against Shigella and H influenza. This is also important, and this is more active against penicillinase resistant streptococcal pneumonia. Okay, these are the salient features of amoxicillin. Carboxypenicillins, we have carbonicillin and ticarcillin. So carbonicillins, they have special feature of this is they are active against Pseudomonas infection. Very, very important. Penicillins which are active against Pseudomonas are carboxypenicillins and urodopenicillins, and they are also positive, that is active against indole positive protease, okay, which are not inhibited by penicillin G or aminopenicillins. That is the extended spectrum nature of this group of penicillins. It is neither penicillinase resistant nor acid resistant. This is also given by IV route. They are also inactive orally because they are acid labile, and they are also excreted in the urine. Their T half is also 1 hour. Urodopenicillins, like carboxypenicillins, I already mentioned, they also have activity against Pseudomonas infection, very important. And the activity against Pseudomonas is 8 times more than that was produced by carboxypenicillins. This also is an important point to be remembered. And they also have good activity against Klebsiella, Enterobacteriaceae, okay, and bacteroids. So this is the extended spectrum nature of this. Frequently employed in serious gram-negative infections causing neutropenia and immunocompromised patients, and also in case of burns patients. There and all we use piperacillin. So last thing of this class, last part, is about something called as beta lactamase inhibitors. So as I already mentioned in the classification, so some bacteria will produce resistance by producing beta lactamase enzyme, which will destroy the beta lactam ring of this group of penicillins, which is the important ring for its activity. So once this beta lactamase is produced and it will open up the beta lactam ring, it loses its antibacterial activity, right? So that is why we are giving these drugs along with beta lactamase inhibitors like clavulanic acid, sulbactam or tazobactam. In this clavulanic acid is commonly used, okay, this class of drugs, so that the activity of this class of drugs is retained. Clavulanic acid is obtained from Streptococcus clavularius. So this is rapidly absorbed orally. Bioavailability is 60%. It is acid stable, and T half is 1 hour. Addition of this clavulanic acid will re-establish the activity of amoxicillin against beta-lactamase producing resistant Staphylococcus aureus, H. influenza, Salmonella, and Shigella. So this is what I was telling. And these group of antibiotics are thus used in case of skin and soft tissue infections, intra-abdominal and gynecological sepsis, urinary, biliary and respiratory tract infection. Wide variety of uses when amoxicillin is combined with clavulanate. Okay, clavulanate is nothing but clavulanic acid. So once it is combined, the activity is good. So moving on to some MCQs. So I have mentioned two MCQs. Please go through. Thank you.